Good evening, everyone. Coming to the evening tonight session forum specifically on wellness, COVID vaccinations, as well as healthcare questions. So today we have invited two of our speakers, Dr. Fabian and Ms. Shireen. So including myself, I'm Kenny. I'm actually a host for today for these sessions, and I'm actually a growth hacker for a startup community. Then before we jump into the questions, I would like to get Dr. Fabian and also Ms. Shireen to introduce yourself. Dr. Fabian, over to you.
Hi, good evening, everyone. My name is Fabian. I'm Dr. Fabian here. Actually, I've been practicing medicine for the past 5 years, around 5 years. Okay, and so far I've been practicing in Australia, and I'm practicing in Sarawak, and coming back here to Kuala Lumpur. And so far I've experienced in rural and urban area as well. So, okay, nice having this forum with you all. Thank you.
Thank you, Dr. Fabian. Over to you, Ms. Shireen.
Hi, everyone. I'm Shireen. So, pharmacist. I'm originated from Penang, so currently practicing in Selangor in the clinic setting. That's it for me.
Right, thank you. Yes, okay. So everyone has aware that Dr. Fabian has a various exposure in multiple countries now back in Malaysia to support us on this COVID fights, as well as Ms. Shireen have exposures in pharmacies, and he will be giving us both gentlemen and also Ms. Shireen will actually give us a very good overview on what is the questions that we will sharing on COVID as well as pharmacy's perspective. So let's go to the questions. Number one that we have actually to Dr. Fabian. Everyone just know about COVID as COVID, but when we ask further, none of us actually know what is COVID-19 stands for. A lot of people actually Google, Mr. Google, ask Mr. Google about what is COVID, but can you give us an explanation of what stands for COVID-19?
Okay, actually, to talk about this COVID-19, we have to go back to the origin. It was discovered in China. It was first reported in China in 2019, I would say around November. So initially, when we got this disease, we actually name it as a Wuhan virus. You all remember? I believe you remember that, right? So WHO actually changed the name to COVID-19 because you don't want to have stigmatization towards China, because they are the one who discovered, and we don't want to label everyone and say, oh, it's a Chinese virus or from China. So they changed it to COVID-19 because it actually stands for Coronavirus Disease 19. 19 means it was discovered in year 2019. So hence the name of COVID-19. Okay, so yeah, so it's actually quite similar to our, if you all can remember, for those who are actually, who actually experienced in year 2000 when there's a SARS outbreak, but it wasn't really affecting Malaysia. So during the SARS outbreak, it's actually the same group of virus. Coronavirus is a kind of virus. There's so many different groups of virus. We have flavivirus. There's so many viruses like a flu virus, like rhinovirus. Coronavirus is a kind of virus from the virus family. So it's actually, I would say it's a cousin of the SARS virus actually.
Oh, so it's the same ancestorgram of the virus, legacy, right?
Yes. It will probably say like for the same lineage, same family. Yeah.
I see. That is how the COVID-19 the name got from. Okay, cool.
Yes.
So yeah, the next I would like to ask Ms. Shireen, right? During the very first wave of MCO, what is the most challenging scenario for a pharmacist like yourself?
Actually, there's two sides. One side, because actually we take care of all those, like the masks, sanitizers. We are the one taking care of them, procuring them, and then we need to supply to those frontliner people. So we are in a messy state in getting them because they are short everywhere. So it's hard to get them. So another side is in the way of in the side of giving patient the medication, because many patients wouldn't want to come to the pharmacy, so we have to come out with many ways on how to provide the medication and then make them reach the patient, either by post or by appointment. We have a bit of struggle on that side. Yeah.
Agree. I think I still remember the very first wave, right? Back in Penang, where mask is become a rare commodity. You know, only per family can buy 5 pieces of mask in one day. So I still remember that was a time where mask has been become a commodity where it spiked up to be per mask is about 1 ringgit to 2 ringgit point of price. So yeah, I think it's very hard for pharmacists to handle that kind of situation as well. So yeah, to Dr. Fabian, right? So since the Delta variant, because a lot these days people talk about Delta variant, right? So were being detected at that point in time, I think as of today, more and more countries being vulnerable, right? And they wasn't have a strictly vaccination that can stop it as of now. So a lot of citizens, don't understand how does it actually develop to Delta variant where all the borders is still strictly closed. So can you share with us from your point of view how actually Delta is being evolved?
Okay, put it this way. It will be very technical and scientific if you want me to tell or how does the Delta variant develop and everything. So I put it in a very simple way, a very layman way. So what happened is actually for this coronavirus, they have many variants. Okay, actually they were reported to be around close to 30 variant actually. But the one that we commonly heard, okay, Delta definitely is the one that on the rise nowadays. We do have Alpha initially, we have Beta, we have Gamma, we have even now after Delta, we even have Lambda. Okay, so why are we so concerned about Delta particularly? Okay, when I said about Alpha, Beta, Delta, and Gamma, these are all actually variant of interest or concern. Why am I saying that? It's because this variant is the one that causes mortality, the one that causes complication. Okay, if the virus doesn't cause any complication, you will just get for example, usually now last time we have like flu. Okay, we have like normal flu and cough. Yeah. Those are all usually caused by virus. But why are we not really concerned about it and don't study about it? Because it doesn't cause any death or anything. Rarely it causes any death. So now why are we so concerned about this Delta? Because of this variant that caused a lot of mortality and is spread very easily as compared to the other variant. Okay, so when we talk about Delta, how does it develop? In a very simple way, it's actually the virus is very smart. Okay, so initially when they actually when just the alpha, usually actually the main first one is the alpha variant. When this alpha variant started, when we develop ways to overcome it. For example, vaccination is one of it. So what happened is these virus, they are very smart. They learn how to avoid attack by the immunity. They learn from their previous their previous ancestor, which is the alpha group. Then they slowly develop the delta. Put it this way: when doctors give you antibiotics, they will ask you to finish consuming it even though you are well. Am I right? Okay.
Yep, agree.
So what happened is, why we want you to consume the antibiotic, finish the whole course. Reason is because we do not want the bacteria to actually adapt to that antibiotic because you haven't fully killed it, and then there's probably some very stronger bacteria that hasn't died yet, and they learn how to escape attack by this antibiotic. So it's the same case for the virus. So now they learn how to adapt to it, and they develop into a stronger strain, more dangerous, more fatal, and as well as easily spread to other places. They learn how to spread through airborne and everything. So this is what happened when you get a different variant. And then that's why we developed Delta variants, because we did not act fast enough, or we did not have the capacity or capability to overcome this virus. Hence, it evolved to become the Delta variant. And the Delta variant, it was originated in India actually, because at that time India has a very, very terrible outbreak. I think during the fourth quarter of last year, 2020. Hence, this Delta variant developed from there, and after that, spreading to other countries as well, including Malaysia.
I see. So it was an unfortunate scenario where Delta was spreading to Malaysia, and now it's even in our community we can My personal self, right, I can hear it, some auntie, uncle says, hey, that one, Pasar don't go now because it's Delta variant already. It was very confusing, but based on what you understand from you, that you shared, the development of Delta, is the virus like, they have a brain that they can, okay, now I need to avoid this in order to grow myself. So yeah, cool. Understand that, Dr. Fabian. Thank you for that.
Okay.
But okay, coming to the questions on sharing, right? I think recently a lot of news has been spreading across, especially in Indonesia, where fellow citizens of Indonesian, they actually rush to pharmacy to procure ivermectin. I think this word ivermectin is not a very hard to find word in Dr. Google now these days, because everyone is just buying in Indonesia. So just curiously, can you explain what is actually the ivermectin do? Does it really help?
A very good question. Ivermectin is probably gaining popularity nowadays. So this ivermectin is actually an anti-parasitic medicine. Layman way, sorry.
Yeah.
Parasite, to kill parasite. Like worms.
Yeah.
And they basically used on animals, used by vets. So probably they have some property that they can kill this coronavirus, but actually everything is still under trial for Malaysia government, and we didn't really get the instruction that we can really use them yet. And even if were to use, they can only be used in the hospital setting, and then with the observation of specialists, and then you really have to monitor them, because they will probably cause kidney problem or liver problem. You never know them yet. Yeah.
I see. So thanks for educating the public. So hey, Mr. Google says ivermectin is very hot in Indonesia, but don't pandai go and buy now lah. But one of the things that I want to actually clarify is from the research, right? Favipiravir, I think the spelling is Favipiravir. I think this was being declared by the MOH, says that it can be used, and then it's approved by the MOH in Malaysia that can be used for COVID-19's recovery. So what do you think, Sharin?
Still same status as the ivermectin. You still need to be used under observation and then close monitoring by the specialist. And then I don't think you can get to buy this medicine over the counter or anywhere. I think they are available in the hospital only currently. Yeah.
Based on the research, it was available in Japan. So
Yeah.
a lot of people is actually now it's global citizens, right? Practically you can buy anything worldwide. The next few days then it will arrive. So Malaysians, don't buy it now, because yes, it's been declared that there's some research about it, but it wasn't being approved or being widely
used. Yes.
Correct. I think they use the word widely used. So please stay safe. Don't pandai, then take illegal. I will use the word illegal medicine for now. Cool. So come to Dr. Fabian, right? Just to understand, recently a lot of news about vaccination caused side effects, being exposed recently. And what is the percentage does the vaccine causing implications, which is lead to fatal incidents, right? Just wanted to understand from your point of view.
Okay, about that, side effect of vaccine. Okay, put it this way. If you want to figure about it, how many percent of people develop side effect or adverse event, we do not have an exact figure, to be honest with you. The thing is, first thing, why we do not have an exact figure. Anyway, whatever I said, just a disclaimer here. Whatever I said is actually just based on my observation and whatever data that I can obtain. The true exact data, it's probably held in the Ministry of Health, which did not release anything like that. So I can't speak for them. I'm just speaking from my experience. So in global wise, let's say you talk about side effect. You just say on average, regardless of which vaccine, whether it's going to be Pfizer, Sinovac, or Astra, or other things, I would say the adverse event that I saw recently published in WHO was around, let's say around 3 to 5%. Okay. In Malaysia, okay, you have to understand that before that side effect, there was severe side effect severe side effect is the one that actually causing like probably patient need to be hospitalized, or maybe need to be observed by a doctor, or probably need to get immediate medical attention. And some of the side effects are very mild side effect. For example, you get like body ache. I believe some of you have get vaccinated. You get body ache. You get like fever, just a bit of temperature rising, as well as some itchiness or pain on the site of infection. So we have two things. We're talking about mild and severe. In Malaysia, what the thing is, what I see is some of them, if they develop mild symptoms, they come and see the doctor for it and they get their medication and all, but they do not report it in the My Sejahtera. You know, actually, when we get vaccinated, I think usually the pharmacist or the doctor or the medical assistant will actually inform the patient to actually report any side effect by clicking a link. There's a link that report any adverse event. Unfortunately, in Malaysia, the reporting rate, I think, is kind of low. There's not many. Okay, maybe some people will say, oh, it's just a bit of pain, or it's just a bit of itchiness, they don't want to report it. But those are actually mild adverse events. Unless those who get hospitalized, then we're talking about a different story. Okay, so in Malaysia, they don't have like an exact figure, like how many percent of that develop adverse event. But let's say if when I was in the vaccination center, we have like, let's say if I vaccinate 100 people, okay, then after that, if they have issue, they actually, because they have to be observed 15 to 30 minutes after their vaccination. So far, I would say like 100 people, probably the figure by WHO is around true, because I will see around 3 to 5 people will actually say, oh, I have this very severe pain, severe flu and everything. But on the other hand, maybe some people, they just withstand the pain and everything, they didn't report it. So, okay, we'll say around 3 to 5%, but I do not have the real figure, to be honest with you, unfortunately. Okay.
Understood. So, which means, you know, out of 100, then 3 to 5 people feel the more severe pain, but some of them can withstand. It depends on their immune system or their body conditions, right?
Yeah, some people have a higher pain threshold. So when they have higher pain threshold, they don't report it. Some people have lower pain threshold, just a bit of pain, then they will see the doctor for some medication.
Yeah. And mosquito bite also, some people will faint already, right?
Yes. But I'm talking about all this. I'm talking about very, very mild adverse event. So far, if you're talking about very serious one, like let's say have to get hospitalized because of difficulty to breathe or swelling, or let's say, very severe skin rash that the whole body skin gets healed. Unfortunately, fortunately, I never see one until now.
Okay? Yeah, that should, right? We don't want to see that happen as well. But in the meantime, to the public, right, you have any questions, feel free to drop down in the link and then share with us your questions. Then perhaps Dr. Fabian or Ms. Shereen can help us to answer. So before we actually get your questions, so we will continue our sessions by going to the next questions, where Shereen just wanted to know, right, recently release of COVID home test kit, you know, how was it works and how much would it cost, you know, from a pharmacist perspective?
Okay, good question. So what does the home test kit actually do? So it actually detect, we call it antigen, which is like bacteria. You can say bacteria or not bacteria, it's virus. So you can say it's a virus or virus debris or whatever, something to do with the virus. So it actually detect if there's a sufficient amount of these particles of virus that can be detected, and then it can be shown on the test kit. It means you have certain amount of virus load in your body, so you might be positive, or how to say you
suggest to do a PCR test, right? So after that,
yes.
Yeah,
so if you get positive from the home test kit, I suggest that you do PCR. But if you get a negative, don't be too happy, because it might be the level of the virus inside your body is too low to be detected, because I've seen so many people that they have negative test kit result, and then in the end they go for this PCR test because apparently they have symptoms, and then they actually get positive results back. So yeah, still wear your mask, sanitize yourself, be careful and stay safe. That's the best way to prevent. And then regarding the cost, it costs about, I think, 30 to 40 ringgit, as I know, selling in retail.
Yeah, I think I agree with Ms. Shereen, you know, when you get negative, right, don't be too happy. So I think when the first time I see that test kit, right, it is the first time for a guy to have the experience of pregnancy test. I will use this word because why? When your spouse doing the pregnancy test, there's a C and T, right? So the two strike. So as a guy, you can experience it. If you really want to test it out, go and buy one from a pharmacy. Test it out. If you are negative, don't be too happy, like what Shereen said. If it's positive, don't be too panic as well. Just report it in your My Sejahtera, and then after 1 or 2 days, go and do a PCR test, or the next day, go and do a PCR test. If you are negative, buy additional kit to do it if you really do want to go to PCR testing kit area to get yourself test out. So don't worry too much. If it's negative, please maintain the safety distance and wear your mask. So yeah, I think the last questions to Ms. Shereen before we answered the questions from public, right? So from your pharmacist point of view, right, what would be the recommendation for citizens to consume, to boost their immune? Because individual immune system will also determine how likelihood you get infected by this virus. Some of them is in the out of the whole family, 3 of them actually being infected, and then 1 of them is not infected or detected as negative. So what would you suggest to fellow Malaysians to consume?
You mean in the form like supplements or vitamins?
Right.
Actually, this is very subjective. I have friends that they don't believe in supplements or vitamins, so I would suggest them to stay on their normal full nutrition, get enough your vegetables, your oranges, get enough nutritions. And then for this group of people, even if you ask them to take supplements or you ask them to take vitamin C, they won't be compliant, so there's no point of taking it. For those who compliant or they're willing to take it, you can boost yourself with vitamin C, because in the end, you know how many oranges you need to take a day to get the sufficient vitamin C. So vitamin C and vitamin D, it's something that can help in your immune system.
Okay, very good. I think thank you for Ms. Shereen for answering my last question. But the last question is to Dr. Fabian. This one will be very, very tricky. With the government expanding the vaccination across Malaysia, so more and more people are taking their vaccination. Will that help to curve down the infection rates in the next 1 month or 2 months time? Because you see, the last 2 days we have been breaking records again, for the detections, right? What do you say?
Okay, I believe the reason why government actually expedite or speed up the vaccination rate is because they want to achieve herd immunity. Okay, they want to achieve herd immunity. The target yesterday, when I heard from our Prime Minister's statement, was the target was by September, which is 1 month from now, or 80% of the population will get vaccinated, which is they're actually aiming for adults above 18 years old. Okay. So, will the rate of COVID goes down? Personally, if you ask me, I think it will go down. Okay, but the main thing you have to understand, the vaccination is not to prevent someone from, not to really 100% deter someone from getting COVID. The main purpose of the vaccine is actually to prevent someone from once they get COVID, to deteriorate, to become to be in the ICU situation where they need to be intubated or need any oxygen therapy. So that's the main goal of the vaccine. And so far, from what we see, actually the vaccine is actually achieving that pretty well. But will the vaccine actually really, really deter someone from getting COVID? Yes, but will it be 100%? No. So will the rate of COVID, the amount of COVID that we see every day, 20,000 and 19,000, will it go down? It depends on a lot of factors. Okay, for me, it's not just about the vaccination. Okay, what we want to do vaccination is actually we want to increase the hospital burden. As we can see, hospital burden is actually piling up.
Yeah,
there's not enough bed. There's not enough. Maybe there's not enough oxygen tank. Maybe there's not enough people to taking care of the patient. So that's the main purpose of the vaccine. And by giving the vaccine, you achieve herd immunity. That means, okay, even if you get the COVID, you won't deteriorate into a very bad state. So that is the main thing. But the rate the virus has been in our public for a year plus from now. Okay, so maybe when someone get the virus, even when they are vaccinated, they probably just get a normal flu and cough. So like last time when we get normal flu and cough, we just ignore. Some people just even go to work. Some people just go for their sporting event and everything. So that's actually what the virus. Let's say someone who's vaccinated, they get COVID, but they don't get a very serious stage, and also depends on someone's immunity. Okay, so I think the vaccination rate, when it's achieved, the rate will go down. But the main thing that we are seeing going down is actually the rate of very severe COVID complications. For example, those who are in category, when we say in medical terms for COVID, when they're saying that category 3 and above, those who need oxygen tank, those who need medication and all. So we're definitely seeing we will definitely see a drastic decrease in that, unless there's a new variant that come out that we do not know. Okay, there's the new variant that coming out in Peru lately, the Lambda variant, which is very, very fatal. I hope it won't reach to our Malaysia shore. Okay, we will reach here, then I'm not sure what we're going to do about that as well. Is the vaccine working for that variant? We are not very sure. Okay. And also depends on the main thing about this kind of amount of COVID. I think the same and old advice goes again. Please stay at home, okay? Because the more you go out, the higher the risk of you contacting the virus, then the higher the amount of COVID will be. So common sense still comes first, okay? Whether will the vaccine really help? It will help, but it still depends on the person's discipline to stay at home. I would say that. Hello?
For sharing the input. So, okay, to the public, right? So you heard what Dr. Fabian said. So don't go out without wearing your mask. Don't go out for the purpose of wandering around for the shockness, right? Yes. Don't go do this kind of thing, right? In this current pandemic, you take care of yourself as well as take care of family. Take care of others.
And also the most important thing, if you haven't get vaccine, go get vaccinated. And proper hand hygiene, very, very important as well. Okay, we actually start doing that since from young. We have to continue that, and even more frequent now since this COVID is on the rise and everything. So common sense still comes first.
Thank you, Dr. Fabian. So we have received few questions coming from the public, right? So I think these questions can Dr. Fabian take it. After vaccination, can we eat heaty fruits like durian or rambutan? Now it's the durian season. No one can don't want to take durian for now. So what do you say?
Okay, right. Okay, for us fellow Malaysian, the love of food is unparalleled as compared to other things, right? I believe. Okay, definitely we enjoy our food, we enjoy our makan session together and everything. Last time, eating durian, going for durian buffet and all those things. Okay, first thing, just to inform, in Western medicine, in Western medical terms, we don't use such word as heaty. I know it's very common among especially the Chinese population. Okay, we always say what 热气 黑 all those things. Okay, what do you mean by heat? What do we mean by heaty actually is those, okay, why we say, like, for example, I just put durian as an example. That's a very, very good example. They say
high
durian,
sugar, is it?
Okay, sugar is one thing, but why we always say when you eat durian, you feel very hot, it's very heaty and all those things, right? Okay, the reason is because durian has very high amount of niacin, Niacin. It's a kind of vitamin B. If I'm not mistaken, sorry, I always got this mixed up whether it's a vitamin B3 or B4. Hang on.
We have pharmacies here, Shireen.
Okay,
to share with us what is
I think it's a B3, if not mistaken as
it's
well.
a vitamin B3, yes.
Yes.
Sorry about that. Yeah, it's vitamin B3. So that vitamin B3 actually produces a lot of energy for your body. So when you produce a lot of energy, what happens is your blood circulation will go around your body to supply oxygen and all, and hence that's why you feel very hot. You feel very hot and you feel very warm in your body. So that's why people thought it's heat. But okay, I'm not discounting Chinese medicine. I'm not discounting other forms of therapy. But Western medicine, we there's no such thing as heaty or cooling or something like that, I would say. Okay, but I mean, this kind of question, I mean, about rambutan and durian, whether can we eat after vaccination? I mean, it's a very, very common question nowadays. For me, there is no guideline saying that you can't eat these kind of fruits after getting the vaccination. But I would just say maybe just to, I mean, I'm not sure how does this vaccine, because you have to understand there's different kind of vaccine. There's so many kind of peoples. Okay, different kind of vaccine have different reaction towards certain people. After, let's say, I mean, just for example, let's say if someone who get a vaccine and then suddenly say, oh, I feel very hot, I thought I'm fever, but probably the person is taking durian or taking rambutan or like that. So we do not know whether it's because of the fruit or whether it's because of the vaccine in a way. So my advice is maybe when you get the vaccination, probably don't take this fruit for 3 days like that. Just wait for the effect of the vaccine to see any adverse event. I mean, that is just my thoughts about it. But do not quote me about that, because actually there's no guideline for it. It's just my opinion about that.
True.
So that's just my advice of all these kind of fruits. Yeah.
Thank you, Dr. Fabian, to answer the questions from the public that durian and rambutan. You can still have it, but don't take it after your vaccination. Come on, you have 1 week, right? After 1 week, go and enjoy lah, right?
Yes,
cool.
yes.
So we have our next question is, should we have breakfast before or after the vaccination? Sometimes people will say, after vaccination you cannot drink, or before vaccination you cannot drink, right? Blood test, this kind of thing.
Okay. The myth about whether can you eat before your vaccination.
Yeah.
Yes, very common question as well. I would say, I think it's better for you to eat, because you don't know how long you have to wait for your vaccination. Okay, I'm afraid that before you reach the place where you get injection, probably you have been, very low in sugar, hypo, you probably fainted, then you can't even go for your vaccination after that. Because we are just afraid that there's any other, medical condition that we haven't screened through. So I think you can eat. I mean, there's no harm of eating just one small pack of nasi lemak before going for your vaccination, or one piece of roti canai, or for Penang people want to eat one plate of char kway teow, go ahead lah. Okay.
Yeah.
So I think you can go for I think you still can eat, but just that, as I say lah, common sense still plays a role. Don't eat too full. Just eat sufficiently. Because after you're eating too full, you have to go for a toilet hunt as well. After you do not know whether the vaccination center toilet is clean or what.
Yeah.
So I think you can eat, but there's no such thing as you have to fast before your vaccination. Okay. There's no contraindication, because you're not taking blood to check your blood sugar or cholesterol. So do eat, but don't eat so much. Yeah.
Okay, here we go, the second myth buster. So actually, don't worry about taking your breakfast or not, because some of the vaccination also, your schedule is actually at afternoon. So it doesn't make sense that you don't eat your breakfast and your lunch and you go and take vaccination. Before you actually reach the queue, you fainted already, then you go to hospitalized, right?
Yes,
no
exactly.
Don't risk, right? So take your breakfast, take your lunch, shuck, go and take your vaccination, go back and rest, okay? So that's how we do it, the Malaysian way, right? So, Shireen, we have questions that, must Panadol or paracetamol be taken before or after vaccination?
Yeah. A lot of people actually, go to the pharmacy before they get vaccine and they get 1 or 2 strips of Panadol to stand by. I've seen so many people that they say, oh, I want to buy Panadol because I'm going for vaccination next week, I'm going for vaccination tomorrow. Yeah, so it's good that you can stand by a few strips, but there's no necessary that you have to take like prophylaxis, like you take, I have to take 1 dose or 2 doses before my vaccine so that I don't feel this, that. No, not necessary. Just that when you have the symptom and it's mild, then yes, go ahead, Panadol can help. But if it's bad, then maybe go for medical advice. Yeah. Okay,
cool. So, I think before vaccination, a lot of people actually get anxiety about vaccination, how deep is the vax will go into my this one, and then is it very sakit or what? Stay calm. I think fellow Malaysian, stay cool with you to go for your vaccinations before that, and then after that get enough rest, drink enough water. I think that is the most medical advices. Usually the doctor says after vaccination, drink more water, rest well, you'll be fine. Right? So the next questions that is leading in here is actually good. I think Dr. Fabian should take it. The recent mixed up of types of vaccine administered to a patient, hey, last time I take Pfizer, now you choke Sinovac, this kind of things happen, right? And then would that leave a severe impact or adverse impact to the patients?
Okay, first and foremost, right, about the mixing of vaccine, I just want to reinstate saying that in Malaysia we don't practice mixing of vaccine. Okay, if you get your first dose is Pfizer, your second dose will be a Pfizer. First dose Sinovac, second dose Sinovac, and for AstraZeneca as well. Okay, I know there's some incident about mixing of vaccine lately, especially on online nowadays, and it's very viral, very fast. Okay, unfortunately, some of it may be due to the mismatch of, maybe some center, they're actually giving two kinds of vaccine. So probably sometimes they mix up the queue. This is all technical error. Okay, unfortunately, this sort of thing shouldn't happen, I would say. Okay, but will it cause harm if you mix vaccination? I can't really answer that question as of now. Okay, I don't think anyone can answer you the question as of now. But put it this way, if you can further read in Germany or in some of other European countries, they actually start mixing vaccination. Mainly they mix Pfizer or Moderna with AstraZeneca. Okay, if you all understand the kind of vaccine that this kind of vaccine, Moderna and Pfizer is a mRNA vaccine, it's a new kind of vaccine, whereas AstraZeneca is a viral vector vaccine. When it mixed, studies found that in the European country, it actually produced higher amount of antibody, in fact. Okay, how does it really work? What's the mechanism behind it? No one really knows about it. I think they are still studying. Okay, I'm also waiting for the result because I myself will be very interested to know about the result as well. Unless it's out, which I'm not sure. Okay. If you got a mix-up in vaccination, okay, sometimes in Malaysia, it could be you're really given the wrong vaccine, sorry. If you're really given the wrong vaccine, please report to the in charge person in the vaccination center. Okay, that's why nowadays some of them actually take down the photo, right? If I'm not mistaken, take video, take down the video and the photo and see what's the dose, like, they say Pfizer 0.3 and then they say Astra is like the other amount 0.5 and all. So you can actually do that now. You can take and you can see, and you can also see the bottles of it and make sure it's the right one. Okay, to make sure that you was given the right one. But let's say if something happens that you were given the wrong one, please report to the vaccination center doctors. They will actually consult with the infectious disease specialists to rectify it and see what can we do. But I have no answer of what can we do now, because I'm not sure whether they will re-vaccine for the other vaccine or what, or they actually just wait for the report from the European country and see what will happen. But so far I have never experienced that in my center yet. Hopefully I won't experience it.
Yeah. Understood. I think it's fair, fellow Malaysians, because we are putting a lot of tensions towards the frontliners like doctors and the pharmacists, right? We need to actually salute them, because what they have been doing, right? They are sacrificing their lives to actually support the fellow Malaysians to get vaccinated. So play our roles or play our parts as well. Before you get vaccinated, cross-check and double-check your vaccination appointment, and then just be repetitive to re-verify it. Okay, your first vaccination is Pfizer. The second one, is it Pfizer? If it's not Pfizer, clarify it, shout out. Don't shy and then take the chuchu and then without doing anything, right? Before the vaccination done, share it out that you are getting your first Pfizer, and then second one is Pfizer. If it's first is Sinovac, like Dr. Fabian, second is Sinovac. So there is no way that the government purposely go and chuchu you for a different one, right? Just to clear the dot, right? So thank you, Dr. Fabian, for sharing your input, and then as well as Ms. Shereen, you have given us a very insightful on the so-called ivermectin and the unregulated unregulated
practice
drugs. Practice. Don't simply take anything that saw online and it says it works for COVID-19. Don't, right? Just wait until the Malaysians say yes. So I would like to invite our president to give our closing speech, as well as to provide our certificate to both. Oh, sorry.
Just before we end this forum, I would just like to put a disclaimer here.
Yep.
Whatever that whatever that me and Miss Shireen talking about COVID today is just based on our experience, based on whatever evidence that we have, and it should not be seen as a medical advice to go and say, oh, this doctor said this doctor said that. Okay, put it this way, in this kind of situation, everyone is unique. Okay, everyone has different immunity, different system, different character and all. So certain things may work for certain people, and certain things may work for majority of people, but doesn't work for some minority. So my advice is, if you're really concerned about the vaccine or the medication or certain things about COVID, that my simplest advice is go to your nearby clinic, your nearby neighborhood clinic, whether it's a private GP or whether it's a government clinic, and ask for advice. Because whatever I say here is a very generic or general kind of things, but it may not be applicable to certain group of people. Just for you all to know. All right.
Sure. Thank you, Dr. Fabian. I think it is really important that to understand everyone is unique, like what Dr. Fabian said. Shireen, anything you want to share before we do our closing?
No.
Oh, good.
Dr. Fabian said it all.
Yeah, the disclaimer quote everything already, right?
Yes.
So yes, fellow Malaysians, don't take our everything as quote us. Remember, seek out to your local GP and then or your local clinic to actually get more medical advice, right? So, thanks for Dr. Fabian and Ms. Shireen. I would like to invite our local JCI Perai President, Mr. Keith, as well as our OC, June, to actually provide us our closing speech, as well as provide our certificate ceremony to our both Dr. Fabian and Ms. Shireen for helping us to share the knowledge and educations, I would say some health tips or educations to our public. Over to you, Keith.
Yeah. Thank you, Moderator Kenny. So good evening, everyone. So thanks to our invited guests, Dr. Fabian and Shireen, for coming to share in this forum. So this forum gives us a very good overview for COVID-19 vaccination and healthcare in doctors and pharmacists' perspective. So this educational forum also gives us the taboo knowledge and also serve to remind to the public to get vaccination and achieving the goal of herd community. So in JCI, basically, we are active citizens that act on our belief that we can change the society to be better. So this is beginning with our self-changes. So we take initiative to be better, empower those people around us, and equip ourselves with the tools to create positive changes in the community and in the world. We lead and serve by example. To understand more about JCI, feel free to go to our JCI Facebook page, JCI Perai, join us and be a part of this family. Thank you, and back to you, Kenny.
Thank you, Keith. At the same time, I would like to hold on to the President Keith to actually present our certificate to both Dr. Fabian and Ms. Shireen.
Yes, I think.
President Keith, do you mind sharing screen so that I can?
Yes, I'm sharing
organizing
now.
Chairperson. Okay, so as the organizing chairperson, I would now like to present the certificates to this healthcare couple. Thank you so much for spending your time to share with us this useful information. So now I would want to present this certificate to Dr. Fabian Perai. So Dr. Fabian, would you look at the camera so that we can take a screenshot of this picture, and this certificate will be sent to you later today.
Say cheese. Who is snapping?
Who is taking the picture?
Are you snapping?
I'm taking. Okay.
Okay.
So smile, say cheese.
Cheese.
One more. Ready? One, two, three.
Cheese.
Okay, so second certificates.
Okay, I now present this certificate to Choy. say cheese again so that President Kim can take a picture of all of us together.
Say cheese.
Cheers.
All right. President, make sure our fellow Dr. Fabian and Miss Shireen is getting the best photo in town.
Oh,
So we won't get rejection.
Unfortunately, I'm not very photogenic to say.
No. To us, your dedication to the healthcare system in Malaysia now is more photogenic than anyone else.
All right, thanks. Thank you. Thanks for the appreciation.
Thank you, President, and thank you, OC, for having this session. Before we wrap up this session, I would like to give a personal point of view that to summarize the session with Dr. Fabian and Ms. Shireen, right? First thing is, don't simply hear out what the community says about the vaccinations as well as what kind of unregulated drugs to take. You think consult your doctors nearby to your GP, nearby to your community, be it is a GP or be it is a private clinic, just to cross-check, get your medical advice from the doctor itself. So it actually helps you to, bust your worry, not to worry about it, right? Second thing is play your part in this community, play your part in this Malaysia's flight, get your vaccination. Don't worry too much, stay calm, go and get your vaccination done. So you play your part in this herd immunity project, right? Contribute yourself. And then the third one is very important as well. When there is a new variant, just always remember, wear your mask. In the next coming 1 or 2 years time, play your part, wear your mask. Despite you are vaccinated, wear your mask, always wash your hands. Don't use your hand to touch your nose and touch your mouth, right? I think this is the very important thing already. So I think these 3 points, I think is the key takeaway that I learned from Dr. Fabian and also Ms. Shireen. I hope the rest of you Malaysians also learn something from this session. And if you like these sessions, comment below and we will try to share more on this in the upcoming event. Stay tuned, right? In the meanwhile, stay safe, everyone. Kita jaga kita, all right? Please play your part and see you next time. Take care, everyone.
Thank you. Bye.
Bye.
Bye-bye.
Bye.